Hello, welcome back to Vallejo Health and Wellness seminar series on vaccinations. My name is Dr. Aaron Moreland, and today we are going to be covering the topic of whether vaccines truly cause harm or not. This is probably the biggest reason why many people have chosen to vaccinate or not to vaccinate is due to the fact that vaccines have the potential of causing harm. So for some people, it's an experience that they did have that it did cause harm, and for some people it's the question whether vaccines do cause harm or not. And so we're going to be talking about that today, and so let's just jump right into it. So when we look at public health, we can see that the assumptions behind the vaccination policies that they have is that vaccines will benefit. Their benefits include the decline of infectious diseases and are the only way to prevent epidemics of dangerous diseases. And so last two videos we covered that, and so if you're wanting to watch those, you can go to our YouTube channel and watch those two videos as well. And so today, though, we're going to be talking about the assumption that vaccines are generally safe. And so what we want to talk about today is that truly the case. When we look at public health, we look at what is the definition of it. So the definition of public health is the policy. But public health policy is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private, communities, and individuals. So public health is not just looking at one person, they're looking at a collection of people, whether that being a town, whether that being a state, could be a country, could be the entire world that when you look at public health, what they're looking at. But we have to realize that in order to achieve this, there may be some people that become damaged in order to achieve the greater good. That they see that when you look at public health, is that they look at statistics and they look to see whether more people will be helped from it than harmed, and then move forward with it, even with the understanding that some people will potentially be harmed. And so when they look at that, then they're not cruel. They really look to see, do the benefits outweigh the risks or not? If they don't outweigh the risks, they're not, potentially not going to move forward with that. And so let's look at vaccines if that is the case or not. So when you look at safety studies, when you look at any drug or any thing like a vaccine, they need to go through a safety study. And so when you look at pro-vaccine advocates, they will point to the fact that over 20,000 safety studies show that vaccines are truly are safe. And so current safety studies of vaccines, though, when you really look at the design of the study, you'll find that there's some things that are different than what you would normally see when you look at a drug being studied for its effectiveness and looking for its safety. And so when you look at safety studies of vaccines, they compare a new vaccine to a second vaccine with a known safety profile. So that basically what they're doing is comparing a vaccinated group to a vaccinated group. The difference is that compared to that in a drug study is that study does not compare vaccinated children to non-vaccinated children. It's not the same then as a study that's using sterile water or normal saline, a placebo. Basically what they're doing is looking to see a vaccine that's already being administered and this new vaccine that comes on the market, is there any more risk to that vaccine than the vaccine that's already out there? The other thing that you want to look at when you're looking at safety studies is who was it done on. When you look at a drug study, typically they'll start with animal studies, then they'll move to healthy individuals, and then they'll move to people that have been that have the disease that they're trying to treat with the drug. But when you look at safety studies of vaccine, they don't do it. They do it on healthy children only, but never do compare it on children that they're trying to work on that could potentially be immunocompromised or sick already. And so the problem with that is you don't know how it's going to affect those children. Or what about children that have a genetic predisposition towards something? We don't know, again, if that's going to make a different reaction in those children, because we've never done a specific study to see if that is the case. And then we also need to look at how long does the safety study go on for. Most studies with vaccines only follow the children for 1 to 4 weeks after the injection. And the problem with that, again, is we don't know what the long-term effects are of vaccines on children. And so when we look at this, we can see that the studies just aren't out there, and we have to look at why are those studies not being done. Many times the defense in that is that they don't want to let children go without vaccines. The vaccines are so important to have that they won't have a group of people that are non-vaccinated to compare to, because they think that it's unethical to not vaccinate them. And that creates a problem, though, because we don't have those studies to see what does a group of children look like that have not been vaccinated versus a group of children that have been vaccinated when it comes to other things such as autism rates and such. So it does raise a question, not saying that we know the answers, because we don't, but saying that why aren't those safety studies being done? Because this is the future of our children's health that we're looking at here. So let's just look at one of the vaccines that's out there that when we look at the public health policy is, should the benefits outweigh the risk? Well, hepatitis B, let's look at this vaccine, and let's look at the disease itself to start off with. It's a virus. The symptoms typically begin with nausea, vomiting, fever, malaise, and recovery is usually within 4 to 8 weeks. So what most people don't realize is that most people that do come in contact with hepatitis B do recover, and this again is according to the Merck manual. Hepatitis B is usually spread by contaminated blood or blood parts. 70% of all infections are in high-risk groups. Primary concern is the potential of cirrhosis or carcinoma of the liver. Chronic carriers become a reservoir. If we look at the United States, that we have less than 0.05% in North America and in Europe that are people that are considered carriers. So it's a very low population that are carriers. In other countries, greater than 10% of the population are carriers. So that's a big difference when we look at using this vaccine in other countries versus North America and Europe. 50% of the people that do get exposed to hepatitis B will develop no symptoms and acquire a lifelong immunity. 30% of the next 30% of the population will develop flu-like symptoms and acquire lifelong immunity. And then 20% will develop symptoms that lead to diagnosis of hepatitis B. So you can see that about 80% of people that are exposed to hepatitis B have no problems whatsoever, and 20% only will develop a diagnosis of hepatitis B. Of that 20%, 95% of those people will fully recover. So again, we can look at about a 5% of the population that is exposed to hepatitis B will ever develop any kind of problems. So therefore, when we look at about 5% become chronic carriers, 75% of those people, of those 5%, will live with asymptomatic infection. So again, 3.75% of all people that are exposed to hepatitis B will again live without any kind of an issue. So then 25% or 1.25% of the people that are exposed to hepatitis B will develop liver disease. But then when you look at the statistics, that's 10 to 30 years after the acute infection. And so the problem with that is you need to also look at what kind of people are most likely to develop hepatitis B, and we can see that the people that are higher risk are usually people that have multiple sex partners. They usually have a higher level of drug use and alcohol use. And so could something else in their lifestyle be causing them to have that liver disease or cancer? And we can absolutely say that yes, there's other things, especially alcohol can cause liver problems as well. So then we look at how the public health comes up with the idea then of whether hepatitis B is more, if there's more risk for hepatitis B than there is for the vaccine. We can look at what the MMRW, which is again from the CDC, says any presumed risk of adverse events possibly associated with hepatitis B vaccination must be balanced against the expected risk of acute and chronic liver disease. And so let's just look at the statistics then. When we look at those percentages, so every year, if we looked at roughly worst case scenario, 300,000 people in the United States being exposed to hepatitis B, then we can look at how many people recover. About 285,000 people will recover. Healthy chronic carriers, we'd look at 11,250, and people that developed cirrhosis or carcinoma, there would be about 3,750 again, and that would happen within 10 to 30 years after they were exposed to hepatitis B. Now, best case scenario, there'd be 14,000 people exposed to hepatitis B, 13,300 people will recover, 525 chronic carriers, and 175 people would develop cirrhosis or carcinoma, and so of the liver. And so we can see that the hepatitis B is not a real significant disease. So that raises the question as to why hepatitis B is even being used in our children to vaccinate for a disease that we can see isn't a real significant problem. And what we look at is that we look at the World Health Policy when it comes to vaccinations, is that many children are vaccinated right at birth when in third world countries, and the reason why is that many of the women there are carriers and they're not being tested for hepatitis B, and because of childbirth, the child could get hepatitis B during childbirth because of mixing of blood. And so we can see that that it makes sense in a third world country that child will potentially be exposed to hepatitis B. But in the United States, where we do test for hepatitis B, we know whether the mother has it or not. And so we know that if they don't have it, what is the purpose of exposing the child to hepatitis B, the Hepatitis V vaccine? So what is the rationale for using this vaccine in newborns in America? In most developing countries, the first dose of vaccine is administered to all infants soon after birth to prevent the perinatal infections. Pregnant women are not screened for hepatitis, and so the vaccine is used instead. So the feasibility, though, and effectiveness of incorporating this approach into the strategy of the U.S. then must be evaluated according to the CDC, again, because this isn't something that's happening in the United States. Then when we look at what the studies, when we look at hepatitis B, let's look at the studies to show what did they do for a safety study. So this comes from the package insert from Merck's dose of hepatitis B. So in a group of studies, there were 1,636 doses of the hepatitis B vaccine. They were administered to 653 healthy infants and children, and they were ages 5 to 10 years old, who were monitored for 5 days after each dose. So we can see a couple problems here. The vaccine was never tested on the age group that they use it in, and it was only monitored for 5 days. The vaccine is typically administered either at birth or at 1 week, and then within the next few months they get the other two doses. So when we look at this safety study, it does raise a question to does this really cause harm or not? We don't know, because to only monitor someone for 5 days, you can tell that it wouldn't have caused the real significant harm that you see instantaneous. But what about the issues that we talk about with potential autism and other autoimmune type of issues? We don't know that. And so people will claim that Merck will claim that they've done safety studies on hepatitis B, yet you can see this is what the safety studies showed. This is the end of part 1 of vaccines. Can they cause harm? Go to our YouTube channel to watch part 2.